Ask the Expert South Texas is furnished by Associates of Audiology, Hearing Healthcare Centers.
Welcome to Ask the Experts South Texas. Each week, we'll feature experts to educate you in all things health and wellness. Call in and be a part of the conversation. 308-8867. 308-8867. 308-8867. And now the hosts of Ask the Experts South Texas, Dr. Nicole Davis and Dr. Don Bledsoe.
Good morning. Thank you for tuning in to the show. You're listening to Ask the Experts of South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
And what do we do other than this marvelous show?
We are audiologists. We help people every day with their hearing and balance.
We do. So what, Dr. Bledsoe, is your hearing tip of the week? We always have one.
So our hearing tip of the week, well, since it is open enrollment for insurances, just keep in mind when you're looking for a new insurance, if you are, that there are some out there that actually do help cover some of the cost of hearing aids.
Mm-hmm. And some pretty good plans,
There are some pretty good plans. And now, actually, there are some Medicare plans that are starting to help pick up some of those costs for hearing aids as well.
That's right. And so I think it's really important when people are looking at their insurance that they look at what the specialties that are covered, that the plan is more comprehensive. And also, like your deductibles, look at those. Look at the 80-20 split, meaning the insurance company, if you meet your deductible, will pay 80, but you're responsible for the 20. But then maybe you have to pay this huge amount of money for them to pick up the other 20. So, like, the devil is in the details, right?
It is. Read it carefully. Always be looking out for what you might need.
Mm-hmm.
So... yeah.
But there are some good supplement plans with Medicare that pick up that 20% too.
There are. Yes. Read the details.
So today we have a really good show because it's along the lines of insurance, but with a real expert opinion on workman's comp as well. We will be talking with Dr. Daniel Valdez with Orthopedic Surgeons. And you are with the San Antonio Orthopedic Group. How does someone get a hold of you, Dr. Valdez?
Good morning. Very simply, can call the office, or we are on now Facebook and some of the social media. There's phone numbers and there's direct lines that we've set up for the different offices, and we have 7 different offices. The main number is 210-804-5400. Or you can find us at www.TSAOG, that's the San Antonio Orthopedic Group, TSAOG.com.
So tell us a little bit before we get into the meat and potatoes of the show, how you got into medicine.
Well, pretty much I've always wanted to go into medicine, wanted to be a physician from as far back as I can remember. Went to a high school where the... was not one of the top schools, if you can imagine. It's in the Edgewood district. Mm-hmm. And we had a counselor who said that because of that, we wouldn't be able to compete. And so I chose to go to nursing school. I was an RN and did that for 10 years before going back. I was working in emergency rooms and ICUs and found that not only could I compete, I was often the most knowledgeable one in the room, including the physicians that were there, about some of the conditions we were treating. I wanted to go back to medical school and be a family practice doctor, and my goal was to come here in West Texas. I was born and raised in San Antonio, and I thought Uvalde, Sabinal, Hondo, some of the places where they have little hospitals and do a little bit of everything. Got into med school, not realizing that at that time I didn't know about residencies and all the extra years you put in afterwards.
Mm-hmm. But you learned.
I learned quickly. Not just 4 years of school, there's another 5 years of residency.
That's right.
But the third year of my first rotation in the hospital was actually doing orthopedics. And I walked into the operating room, and there was a table full of hammers and saws and chisels and screwdrivers. And my hobbies are woodworking and leatherworking.
You're like, I feel at home.
Oh my God, I can
this
combine
is it.
my 2 dreams. And I tried to talk myself out of it because family practice is only a 3-year residency and orthopedics is 5 years. But it didn't work. I loved it and got into orthopedics and have never looked back. It's been the most fantastic journey I could have ever started.
Well, it's the structure of the body.
Yes.
What keeps everything going, right?
Absolutely.
So, day to day, you see a lot of workman's comp cases, and we really wanted to talk to you a lot about that today, because there's a lot of injuries on the job with knees, hips, and the back. So what are you seeing as far as the regulations go? Like, what are the time frames if someone is injured on the job? How many days do they have to get treatment?
You actually only have 30 days to report the injury. Beyond 30 days, they may not accept the report at all. Now, once you've reported the injury, you have 1 year to turn in the formal paperwork. And that's 1 year from the time you were injured or 1 year from the time you found out you were injured. For example, if you work in a company that deals with chemicals and 5 years into this job, you find that you've got a terrible lung condition. And on that day, the pulmonologist, your lung doctor says, this was caused by the chemicals that you work with. Your year starts on that day.
Okay, but do you have 30 days from that day also to report it?
Yes.
Okay.
The paperwork, formal paperwork has to be in within a year, but only 30 days to report it.
Wow.
Okay, so by law, does an organization have to carry workman's comp?
Yes. In Texas, you must have some form of workers' compensation. There's 2 ways to carry workers' compensation, and that's called subscribers and non-subscribers. Subscribers are the ones that follow the true letter of the law. They hire a workers' compensation insurance company, and they follow all the laws and rules that the state sets forth. Non-subscribers are people that choose to have an insurance outside of traditional workers' comp, and that can be self-insured. You have your own pool, or you can join a group of other employers or companies of the similar type, and then pool your monies to pay for injured employees. Even the non-subscribers have rules, and they have to follow that set of rules. Those rules are a little bit, I was going to say looser, but they're actually a little bit more structured toward the employer than the employee, because it's all by contract. The difference is that a subscriber is immune from lawsuits to most degree, and the non-subscribers can be sued. Lawyers can get involved with
because they're
treatment.
responsible for covering the damages.
That's correct.
Yeah. So, so it's very important when someone is going in for their new hire paperwork that they ask these questions.
By law, they have to tell you, but they don't often tell you outright. It's in exactly what you were talking about. Read the fine print, because you'll get a letter or a note that says sign at the bottom, and that may be a contract that you're agreeing to a non-subscriber, that you will agree to see their physicians, you will agree to their decisions, and that you have time limits.
Does it also waive legal to arbitration?
It can.
It can.
And oftentimes the arbitration is set into some of these contracts.
So really read the fine print.
Yeah, understand what your company has as far as workers' compensation.
I would say especially if you're in a job where there requires a lot of physical labor.
Yes. That becomes an issue because
it's chronic wear and tear on your joints.
Right.
You're an orthopedic surgeon. So then what are the common, incidences of injury that you're seeing?
The 3 most common body parts is the lower back, the shoulder, and the knee, in that order. Then, of course, there's the hands and carpal tunnel and other things that may or may not be related to the job. And we're now having a lot of studies that are producing information about what causes certain conditions that we've always assumed were caused by overuse. In the lower back, it becomes a difficult subject because we all start to develop some wear and tear on the back. So at what point is it just low back pain because I'm old and worn out, and when is it that that I actually got hurt on the job? And so you have to kind of make that decision.
Yeah.
And you need to work with your physician so that he can set up a plan for you and then establish whether this injury was related to the incident that happened at work. And if it is, that statement has to be made so that workers' compensation understands that you did get hurt on the job.
So you said it was your lower back, your
Hips and
hips
shoulder.
and shoulders.
Shoulder and knee.
Shoulder and knee. Of those three things, which one heals the slowest?
Of the four.
Of the four. No, there's three.
Of the three, the lower back.
Oh,
The lower back heals the slowest. Why?
Well, it's just because everything you do, from sitting to standing, carries weight through your back. So everything in the
It
front
makes
of
me
your
sit up
body,
straight.
yes,
Because I'm like hunched over, like, huh? Oh, sit up.
yeah,
Okay.
gravity constantly wants to pull you forward on your face, and your back has to
Face
pull against it. Yeah, so 1 pound around the middle pulls me forward, and that makes my back work harder to pull back to keep me upright. And so we're constantly using our backs for everything, even to sit. And nowadays, we do so much work on computers, and we kind of hunch over, and at the same time, we twist our neck to be able to adjust to the screen. And if you've gotten to where you need reading glasses, like I do now, they don't always focus on the screen right, and you have to twist your head around, and all of a sudden you find yourself achy and sore.
What if you have a desk job?
There's a lot of information coming out about desk jobs. We're finding that if you simply stand, it reduces cardiac conditions by over 50%. And so you're starting to see all of these desks that have adjustable tops to where you can stand or sit. I think it's going to be very important that we learn to get up and move around and not sit, because sitting seems to be one of the worst things for our hearts, our backs.
So you should go walking at lunch for sure.
You should. You should.
I could eat and walk.
Unfortunately, we've all kind of mastered that skill, haven't we?
I can drive and eat. I can walk and eat. Let's go around. No, but it's important. You need to get up and move, right?
Yes.
Okay, so the shoulder, though, is someone once told me, is a very simple structure that's very susceptible to injury.
That's correct.
Okay, so they weren't telling me false.
No.
So, but once you injure it, it's also very difficult to heal, no?
Well, it depends on what the injury is, because there's several things that can be hurt. The most common thing we hear about is the rotator cuff.
Yeah, right.
It's 4 muscles that help position your arm where it needs to be for fine motor. So your deltoid, your biceps, your triceps, they'll lift your arm up in the air. But if you're trying to write something on a blackboard, well, I guess nowadays it's a whiteboard, it's those small muscles that are firing to let you do that. So depending on which one you've torn and what needs to be fixed, it will depend on what the healing is.
Does that go along with the amount of blood flow to the area then?
The funny thing is that we have very little blood flow to our ligaments, tendons, and cartilage. The way that, these structures nourish themselves is by absorbing nutrition by the surrounding fluid, the synovial fluid.
Right.
It's the lubrication fluid that's around the sheath, around the joints. Well, how do you get it in there? Well, it can kind of float through a little bit, but just like a sponge, if you squeeze a sponge and put it in the fluid, it absorbs a whole lot more than if you just lay it there. So what actually causes your ligaments, tendons, and cartilage to lose the used up fluid is for you to compress it, in other words, stretch it or push on it, and then during the relaxation phase, it will absorb new fluid that provides nutrition. So let's say your knee cartilage, the way you compress it is simply by walking, using it, passive motion, range of motion. A stationary bike would be excellent for that. For your shoulders, you need to do things like Tai Chi, Pilates, yoga. Pilates is actually one of the most joint-sparing exercises because it forces you to stretch and relax. And I think that's one of the most important things to nourish these structures.
Which goes back to non-movement. If you're not moving, you're not getting to the joints the nourishment that it needs.
I frequently get a question about how much activity should I have. I've got arthritis of the knees or the hip, so should I stop walking because I'm just wearing it out? And the answer is no. If you sit on the sofa and watch novelas, that wears you out.
But it's so good.
But it wears you out so much more than getting up and walking and doing things.
You can go around a track on your phone, watching novella and walking.
You can.
I haven't tried that.
But I mean, there really is a common misconception. Oh, it hurts. It's the arthritis. I need to not use it.
No, you need to use it.
But what you're saying is you really need to work that joint. You need to get up and move
in a healthy way. Yeah,
to keep it from getting worse.
That's right.
Okay, so so the common workman comp accidents or injuries that you see: lower back, hips and knees. So, say someone comes in, and I'm going to give you a scenario. When we come back, we're going to talk about it. They fall off a ladder, and they go into the doctor, and with workman's comp, they report it, and they find the injury, but then they also find arthritis and surrounding injuries. What will workman's comp also kick in if it worsens those conditions? We'll talk about that when we come right back from this break.
Do your loved ones say, "You're not listening"? Do they tell you the TV's too loud? Or do you have ringing in your ears or feel dizzy without explanation? Call Associates of Audiology. They are the experts at diagnosing and treating hearing loss and balance disorders for all ages. Call 210-334-0245 or see them at associatesofaudiology.com for a better quality of life. Don't let your ears keep you from hearing.
We're back. You're listening to Ask the Experts of South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
And we are talking with Dr. Daniel Valdez. He is with San Antonio Orthopedic Group. And if you would like to get some help with your bones and joints, you can go to their website at TSAOG.com or call 210-804-5400. So we were talking about workman's comp, and say because you've been working for this company for a couple of years, you're wearing your body out, you're starting to get some forms of arthritis in your joints, and maybe you have an injury fall on the job, and you call in for the workman's comp and you go into the doctor, but then they see these other issues that are going on around the injury that maybe are kicking it off and making it even worse. What happens?
Well, this is why you have to go to somebody that's experienced in dealing with workers' compensation system, because by statute, by state rules, insurance companies that cover workers' compensation injuries don't have to cover degenerative conditions. They only have to cover the conditions that occurred on the job. However, we are the sum total of our past. So if you fall off a ladder and you injure your knee, say you have a meniscus that's now torn, but the MRI is also going to show that you've got some areas of degenerative meniscus, you've got areas of arthritis, you've got areas of lost cartilage, you've got areas that show bony spurs or calcifications, and more than likely the insurance is going to say that's not any of ours. But there's no way that you can fall off a ladder and not aggravate or change some of those other conditions. Mm-hmm. So you need a physician that's experienced in looking at MRIs, looking at your condition, looking at the mechanism of injury, how you fell, how you landed, and try to determine what you injured and what was it that you aggravated or changed because of that fall. This is one of the most important parts of determining what's workers' compensation. So if you're the one that falls off the ladder and you do your report, you need to go ahead and include exactly what you were doing, why you were doing it, and how you fell, because that's going to be very important in determining what other injuries were caused or what other injuries were superimposed on your pre-existing conditions.
Because you can maybe get treatment a little bit more for those as well.
Yes.
Included into the plan,
absolutely.
The treatment plan. Yep.
Okay, so let's say you do get injured at work. You have 30 days to report it and then a year to file the paperwork. What does the employer have to do? I mean, do they have to hold your job? Do they have to?
If they are subscribers, they have to hold your job for 10 weeks. They have to hold a position for 6 months. So if you work in a company that has 3 shifts and you've worked your way up to day shift, they'll hold that position for 10 weeks. But after 10 weeks, they may bring somebody else into the day position, and when you come back, you may be coming in at the 11 to 7 shift. After 180 days, your job can be terminated, and they can hire someone else. There are other jobs that have contracts that you will sign that says specifically how long they will hold your job. And if they're non-subscribers, that's going to be built into the contract that you signed when you were hired.
Again, read the fine print.
Right.
So what if you travel for work and you're going from one of your offices to another, and let's say it's a car accident, and we end up in your office. Does the employer still have to hold that position, that job, for 10 weeks and then the 6 months?
Well, I think legally they're supposed to. That's on the job, right?
Yes. Traveling, whether it's traveling from one office to another or whether you're traveling by airplane to go to some conference that's related, all of those things are included. So if you're taking your luggage out of the overhead and you're on your way to a work conference or a work meeting, that shoulder injury will be included.
Okay.
You have to be very careful about how these things are reported, because very commonly the workers' compensation insurance may want to make sure that it's not covered, okay?
Right.
There's a phrase called reasonable access, and that means that if you show up to your job and as you're getting out of your car, you trip on the curb and you get hurt, that may be included. So you don't have to actually have punched in to be covered.
Oh.
Because it was on the premise, maybe?
Well, that's where the phrase reasonable access. So it's they have to provide coverage during a reasonable access. So now, if you get back in your car and you go down the street to buy some fast food, that may not be covered. But if you come in the morning in your normal fashion and you park and you're headed in to punch in,
I see.
That can be covered.
So, do you see people that, okay, we have to address this, maybe aren't so hurt and that are trying to have a 10-week vacation?
The reality is that the majority of people are good.
Yeah.
They come in, they're really hurt, they want to get better, they want to get back to work.
Do you have that one rotten apple?
There's a small percentage that do that, and they have repeat injuries, they have a long period of recovery. That can happen, but
it's documented.
Most of the time, I'll have a talk. I'll explain what the system is. I'll explain what my expectations are for their injury and how they'll be treated. And the majority of people will say,
Comply.
"I understand." Now, if somebody comes in with a very minor injury and they're looking at taking a long vacation, and I have the talk with them, sometimes they'll choose to go to another doctor. They'll say, "He's not going to be he's not going to cooperate. Let me get out of here."
But you can sleep at night, so that's what you got to be ethical.
Absolutely. If they're hurt, I will fight tooth and nail to get them treated. And if they're not hurt, I'm going to explain it to them and say it's time to get back to work. Yeah.
Well, if you're just joining the show, we're talking with Dr. Valdez, and he is. You can go look at his bio and his company he works for and go see him at TSAOG.com, or you can call him at 210-804-5400.
So, this being the holiday season, I'm sure there are more than enough holiday injuries that happen. People hanging up lights, falling off ladders, carrying the tree in and wrench their back. So what's the most common holiday injury that you guys see?
The funny thing is, this week alone, I've seen 3 people that had holiday injuries. There's 3 types of holiday injuries.
Griswold Christmas?
Yes. Yeah, absolutely. It's the pre-Christmas injury, the after-Christmas injury, and the after-New Year's injury. The pre-Christmas injury are predominantly people putting up lights, climbing ladders, or worse than that, using chairs or inappropriate things to climb on to hang their lights.
We're all guilty.
Yeah.
I know.
The post-Christmas are the people that got new toys, they got a bike, they got a skateboard, they got things that they're not used to using, and those are the wrist fractures, the ankle fractures, all the injuries. The post-New Year's are the guys, the middle-aged guys that, they make the New Year's
they want to get
resolution.
healthy, and they do
New Year's resolution, and the kids
out.
gave them a P90X, or they gave them the Insanity CD or the
Insanity
DVD,
CD.
and they come in with all kinds of overuse.
Okay, that's funny, because on those Insanity, some of those things, they go fire alarm, and then it's this intense thing that you have to do for 3 minutes, and then so I did it with my sister, right, and we're doing this workout for 30 minutes, and she said fire alarm 5 times, and finally I was yelling at the TV, I'm not doing a fire alarm, I can't do this, because it was too intense, too quick. You need to slowly get into that exercise.
Orthopedic surgeons love those exercises. The CrossFit. Oh my gosh, we get so much work from CrossFit.
Oh no, those bells that you have to lift and everything,
the
and
kettlebells.
using the back instead of the knees. It's not healthy. Well, so people need to, one, if you have balance problems, if you get vertigo with heights, you do not need to be getting up on a ladder, hanging up lights, put a wreath on your door, or hire it out.
Absolutely.
Right? Put a wreath on your door.
Put a wreath on your door, yes.
And you can get those lights on the deer that light up, and you just put the deer in the front yard, and there's no climbing at all.
And now there's those blow-up things that they're selling everywhere.
Oh, yeah.
Those are
Fine. It's but for you want to see them. So if you do have an accident like that, you're going to come see Dr. Valdez.
That's right.
He'll get you straight and worked out. So we're going to take a quick break. When we come back, I do want to continue on with the workman's comp conversation, talk about the different types of treatment plans you're going to have for the knee, the hips, and then when does surgery become the option instead of therapy, like physical therapy. So we'll take a quick break and we'll be right back. You've been listening to Ask the Experts of South Texas. We are back. You're listening to Ask the Experts of South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
And every week we have the joy of talking to South Texas about their health with the different medical professionals that come in here. We learn a lot about the different parts of your body, how they function together, how to be healthier and have a better quality of life. But your hearing also affects the quality of your life. It affects the loved ones around you. Many times our patients come in with their spouse or partners and say, it's not only impacting how they can function in life, but the quality of our relationship and our communication is not as good. They can't participate and enjoy sports or leisure activities that they used to enjoy. I've had a lot of patients say that when they go to watch movies, go to musicals, listen to music, it's not as well appreciated, so they just stop going. So it affects their activity levels.
Even family functions, just going to eat dinner at your son or daughter's house or whatever, they struggle.
So the good news is there is technology that actually is discreet. Nobody needs to see it. It is prescription based. When I say that, it's off of your hearing thresholds. So it's not like something that you get at the convenience store that just brings everything up loud. I call those tinker toys. But it's actually off of a prescription that an audiologist like us puts in there, and it manages the noise around you, and it gives you only the sounds that you need according to your hearing loss. So if you want some help, where do they come and see us, Dawn?
You can find us on the internet at associatesofaudiology.com, or you can call us at 210-334-0245.
And we take all insurance.
We do, and we have 6 offices. How many offices do we have? We have a bunch.
So we're in Kerrville, Bernie, and 3 in San Antonio. We've got a great staff, friendly, and we will definitely treat you like family, so come and see us. So back to our topic of the day. So you can go to www.TSAOG.com, and that is with San Antonio Orthopedic Group. The first 30 minutes we were talking with Dr. Daniel Valdez. He's an orthopedic surgeon, and he has extensive experience in workman's comp. In fact, you're in charge of the workman's comp management department at your company. So you know the back end of it, the front end of it, from start to finish. So when someone comes into you, they have an injury, they've reported it to their employer, you're going to come up with a treatment plan off of what you see and what you find. So say it's a pretty significant injury that involves surgery. Do they still have only 10 weeks for that recuperation time?
Yes, in general it is, but many of the companies will work with you. In fact, San Antonio has many great employers that will work with their employees and the injured employee to try to get them back in some fashion. It's pretty well been shown that if you stay at work, you're more likely to get back to work at some level much faster. So light duty, restricted duty, that type of thing is actually a very important part of the program.
So you can still work at your job and not be at risk for losing a position or your job.
Well, I have one of the colleagues that works at one of the major companies here is an occupational medicine doctor, and he says that sometimes we on the outside don't understand what the work injury is. For example, if you have somebody whose job it is to cut a sheet of paper with a pair of scissors, you say, how can that be overuse? Well, what if they have to cut 5,000 sheets of paper every hour for 8 or 10 hours?
Mm-hmm. Okay. Carpal tunnel.
The muscle, ligament, tendons. And so you can build yourself up to the point that you can do that, but you can also get hurt. And it's also something that a minor injury can affect your ability to cut that piece of paper with a pair of scissors 5,000 times an hour.
So maybe they can cross you over to a different job duty.
And that's what he's arranged at the company where he works, is that every 2 hours or so, they move you to another place that works a different part of your body.
Oh, that's
so
smart.
You may be doing a right arm job for 2 hours, and then you're doing a left arm job for 2 hours, and then you're doing something that takes back bending for 2 hours, and it shifts. And everybody gets cross-trained. Does two things. Number one,
Smart.
It reduces the repetitive injury. And number two, you've got employees that are cross-trained to do other jobs if an emergency should occur.
That's really smart.
I know James Avery does that.
Really?
Mm-hmm. They're very, I think, conscious of that type of stuff.
I didn't know that.
Yeah. And they're up in Carpal. That's the only way I know, because I know some of them. That's an important idea, that you have good communication between the doctor, the patient, and the management.
Yes.
So when you go back with a recommendation and it's followed, so 10 weeks, hopefully they can still be involved. But what if it's a catastrophic event where they hurt their back and they can't go into work? When do you see those that involve surgery?
Okay, surgery. Let's talk about that for a second. When or why should you do surgery?
Right.
In Texas, we are obligated to follow a guide called the Official Disability Guidelines, ODG. And you'll hear that acronym all the time, ODG. ODG tells you that if you have a meniscal tear, what the conservative measure should be, and then at what point it can become surgical. The reality
so there's an actual guideline.
There is, but the reality is that if you've got experience, you may find that the guidelines not always completely correct. And so really we should individualize our treatment. We should take someone, figure out what it is that they need to do, and figure out what their symptoms are. So if somebody comes in and the MRI shows a meniscal tear, but they have absolutely no symptoms, they have no locking, no catching, no swelling, no pain, the book may say that you need surgery, but you really don't need surgery if you're not having symptoms. So we shouldn't be treating the MRI or the book. We should be treating the individual injured employee.
Does a meniscal tear heal on its own?
You know, there's some debate about that. If it's out close to where the blood supply is, they do heal. And I have seen MRIs where there was a tear. Somebody comes in several years later with another injury. The MRI shows that the previous tear is gone. It's erased. Recently had a case where an MRI was done of a shoulder with a rotator cuff tear, and the radiologist read it as a complete tear. Pain continued for about 18 months, and someone did surgery. And when they went in there, they actually did an open surgery, which is not that common anymore. Everybody uses arthroscopy now,
right.
The laser-type surgery. And he found that there was no tear. So either the MRI was wrong the first time, or it healed. So I think some of these things do heal. Where we used to think they didn't, they do. I've seen MRIs of someone's back that has herniated disc, and a repeat MRI a couple of years later finds that the herniated disc is no longer there. The extruded fragment is actually completely gone, and the disc is fairly restored. So a lot of things that we were taught that don't heal can heal, and if we give the body a chance to restore itself.
Is that age-related or genetics or just random?
I suspect that a lot of it is genetics. Some of it age-related. As we get older, we don't heal as quickly, but we're starting to find that there are genetic markers, and now that there's a remarkable amount of information coming out. When I went to school, DNA and genetics had a paragraph, and by the time I finished school, there was already the chapter, and now there's entire books about the subject. Work that's being done in Northern Europe has shown that there's at least 3 genes that are associated with back problems.
Really?
So if you don't have any one of those 3 genes, those are the people that get to the age of 90 and never had a problem. If you've got all 3 genes, these are the teenagers that are already having surgery before they're even out of high school. It's an interesting subject, and I think there's a lot more information that's going to come out very quickly. The amount of information that's being produced is just like an avalanche. The further it gets, the bigger it grows.
So really, with getting back to the workman's comp, you can have that whether you have a desk job or a heavy lifting job then.
A lot of the desk job injuries are not what you would consider. They're more like the phone rang at the other desk, and I jumped up to go answer it, and I got my foot caught on the extension cord and fell forward and broke my wrist or tore my rotator cuff. So those are true injuries, but they're not exactly associated with the work that you're doing. It's just things that happen on the job.
Okay, so let's say you have a desk job and you pretty much sit at your desk for 8 hours a day every day. I know that you can have some disc compression in your back from that.
Is that work related?
Is that work related? I mean, I would say it is.
The ruling on that tends to be that it's a condition of life. It's a normal process. So that would be a degenerative condition, and therefore under current rules would not be included as a workers' comp injury.
Okay. Just curious.
Maybe that'll change.
Maybe.
With, some, well, we're learning more every day, but legislation and law takes time.
Well, I don't really want to get into the politics of medicine at this point, but the reality is if we had universal coverage, we wouldn't have to decide on whether it was personal injury protection with a car wreck or workers' comp.
You're right.
You're just covered. So if you're sitting there at your desk and your back hurts, you go in and you get treated without having to have a panel of people deciding on whether it's work comp insurance, it's your personal insurance, it's your auto PIP.
Yep.
So if you're part-time at a job, do you qualify for workman's comp?
You may not. Sometimes below certain hours it's not. But in other situations, the work injury that occurs on the job is covered whether you're part-time or a temp.
So it just depends on your employer.
Yes.
We're going to take a quick break. We'll be right back. You've been listening to Dr. Daniel Valdez on Ask the Experts of South Texas. We'll be right back.
Listen, it's getting louder every day.
Do your loved ones say, "You're not listening"? Do they tell you the TV's too loud? Or do you have ringing in your ears or feel dizzy without explanation? Call Associates of Audiology. They are the experts at diagnosing and treating hearing loss and balance disorders for all ages. Call 210-334-0245 or see them at associatesofaudiology.com for a better quality of life. Don't let your ears keep you from hearing.
Everybody's talking at me.
And we're back. You're listening to Ask the Experts of South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
And we are with Dr. Valdez. And he can be contacted at 210-804-5400 with the San Antonio Orthopedic Group. We've been talking off and on about workman's comp all hour. So what happens if you are in a car accident? You're traveling between 2 locations with work, but you've got really good private insurance and really good car insurance. What happens with workman's comp?
That becomes a real issue. And I'll tell you why. Because now you've got 3 insurances, and they're all pointing the finger at each other about who has to cover what. And we had a recent situation in which somebody was at a red light in a company car, and somebody that was admittedly texting ran into them without touching their brakes. So now he's hurt, and the auto insurance has a personal injury protection clause with a commonly known as PIP, but they don't really want to cover because they feel like it's workers' comp because he was on the job. He shows up into one of these emergency urgent type places, and he doesn't have the paperwork for comp yet, so he tries to use his insurance, and he actually has a very good insurance. Young man, he's still covered by his parents, and his parents have really one of the best insurance. Well, they'll take him in, they'll start to bill that, but when the insurance company finds out it was an auto accident, they don't pay. They stop. They go,
really?
Yeah, it's they should use the car. Oh, wait a minute. He was on the job? It's work comp. And then comp is saying, we need to investigate this. So now you've got 3 good insurances, and nobody's paying. So as much as the providers want to help, most of the companies won't allow you to do it for free. So you're stuck.
So that delays your treatment, and your 10 weeks has already started.
And the reality is that if you start treatment and you understand what the problem is, diagnose it appropriately, and then begin using your options, your recovery is much faster than if you're sitting home, on the lazy boy watching sports because nobody's taking care of you, and you're getting stiff, and you're getting deconditioned, and you're getting weak.
Right.
So for injuries, man, that's a problem. But for injuries, where say they've gotten their 10 weeks of treatment, but they're going to need physical therapy indefinitely, are they just handling that on their own with their private insurance?
If we go back to the ODG and you open up the section that says physical medicine, it'll tell you exactly how many sessions they have to pay for each diagnosis. So if you have a shoulder strain, you'll get 12 sessions paid for. If you have a rotator cuff tear that's treated surgically, you have 23 sessions, and that can be spread out over 8 weeks.
What if the surgery doesn't work?
That's always a risk. That's always a possibility. Most of the time, if you go to experienced physicians that dedicate themselves to that job, you get a much better outcome. If you come to me and I do everything from toenails to back surgery to everything, you're not going to get the best job. But if you go to the doctor that does just spines, he's going to do a better job. Not only is he keeping up with the latest technology, he's doing it in a way that he can adjust on a day-to-day basis.
So you go to the doctor that's done 1,000 plus of that specific.
Right. He's learning from the ones that didn't do so well. Like you're saying, if the surgery doesn't work and that's all he does, he starts trying to figure out what it is he needs to change so that it works more often. And I tend to use my colleagues. There's 32 surgeons in the group, and each one has a specialty. And even within the same specialty, you may have 3 hand surgeons, but there's someone that does
specialize in different
one
parts.
thing's a little better than the other, and you kind of try to be objective and figure that out.
So I've got a very crazy question. Because everybody traveled for Thanksgiving, right? Why is it when you've been traveling for an extended amount of time, your knees start hurting, especially for women?
I think a lot of it is the immobility.
It's called movie theater knees.
Yes, exactly. No, but you know what? The reality is...
Yours don't hurt?
Everything hurts.
But it all depends on how flexible you are. There's a simple test you can do to check some of the lateral part of your hip and knee, and this has to do with how your kneecap tracks, and that has to be with what hurts when you sit there for a while. If you lay down flat in bed or flat on the floor and put your ankle of the right just below the kneecap on the left, and then try to touch the tabletop or the bed top with the lateral thigh. In other words, you're making a figure of 4.
Yeah, okay. Is the foot over the kneecap or under?
Just below it.
Okay.
On top of the arm.
Gotcha.
On top of the leg, rather, but just
under
below the
kneecap. Okay,
and
gotcha.
Then the outside of your thigh touch to the top of the bed. And if you're normally flexed, you should be able to touch the mattress with the side of your leg.
Okay.
You're going to find that most of us have 6, 7, or 8 inches short of the tabletop. That tightens your IT band, your iliotibial band is tight, and that causes some of the tracking of your patella to be outside, and it grinds on the femur where it's supposed to not grind. And when you sit there for a while, you get stiff, and it hurts. When you first get up, you've got that 2 or 3 second thing to straighten your legs, and then
And
the
it
first
hurts
two
right underneath that kneecap.
And the first 2 steps are kind of shaky, and then
Interesting.
and that goes back to exercising, the Tai Chi, Pilates,
stop.
yoga kind of thing.
What are you saying? I gotta do.
It's not my knees that hurts. It's my hips that hurt.
Your hips hurt?
After sitting for a really long period of time, yeah.
Why are her hips hurting then?
Probably the same thing.
See?
See, the IT
Don't
band-
look at me like I'm the only one.
That.
You gotta move
Are
too.
you sure?
We gotta do a Pilates again.
I know.
We gotta go to Pure Barre.
Oh, I know.
But it was healthy.
Oh, no, I liked it. I did. It's
okay.
just it's hard.
Most hard things in life have great rewards. But you gotta tiptoe into it with exercise.
You've got to build up to it.
Or you're gonna have some injuries.
The older you are, I'm sure y'all don't know anything about that. Y'all, it's the young things, but it takes.
Say it again.
Everything has to build up slowly. If you walk 2 miles a day and you suddenly start walking 5 miles a day, you can develop stress fractures. A stress fracture is just like taking a paper clip and bending it till it falls apart. That's a stress fracture in metal. Well, the same thing can happen with bone. If, on the other hand, you go to 2 1/4 mile, then 2 1/2 miles for several weeks, and then 3 miles, and slowly build up, you can build up to 5 and not have a stress fracture. It's the sudden change or
It's
sudden
the stress on the...
Yes, the sudden change in activity. The same thing can happen to your ligaments and tendons. So if you're a stalker at one of the RHEB and they suddenly move you to the...
Not a stalker of people.
No, with an O, not an A.
Right? I'm a stalker. You better watch out. I can the green beans in a row. I get the yams just right.
Yeah.
Go ahead.
Suddenly they
Sorry.
change it to the checkout counter. You can develop carpal tunnel for a period of time because now you're using your hands in a totally different way than you were using before.
Yeah.
But if you build up slowly, you can avoid that.
Could you also possibly get a stress fracture like in your leg from standing 8 hours versus bending up and down and moving?
I think you get bone spurs, no?
I don't know.
The stress fracture has to have some motion.
Oh, okay.
And it all depends on how you built up to that. Now, bone spurs, we talk about bone spurs as being a problem, but they're not. They're a symptom of a pre-existing or underlying problem.
Like bone on bone, and then you start developing...
The inflammation in a ligament or a tendon, the center part of it becomes necrotic, and your body will lay calcium there because it won't accept dead tissue, right? Well, if it grows long enough or big enough, that spur that may become a mechanical problem later, but it wasn't the original problem.
Right.
Now, the bone-on-bone is a different issue. That's wearing out your cartilage. So the articular cartilage, which is like Teflon that coats the bones to let them slide, you can wear that out.
And then we're getting close to the end of the hour, but the last thing I wanted to talk about is if you look at the bottom of your shoes, right, and you see where the wearing down pattern is, you will find if you're rolling your feet in or if you have really bad orthotics or poor arch support or what I call cheap shoes. So it's important to look at the pattern of the wear at the bottom of your feet because you might find that some of your problems with your knees and your hips are partly...
That's actually a very important point.
See?
We have runners who come in and say, I run all the time, and now I've got problems with the inside of this knee or the outside of the heel. And all you do is take their shoes and lay them on a tabletop and look at the back on the heel. They should stand straight up. If they tilt in or out, you've already broken those shoes down. And they'll go, wait a minute, I paid $200 for those shoes 6 months ago. They can't be broken down. That's what you're looking at it. And that changes your mechanics. That changes the way your
Causes
ankle
injury.
strikes. It changes the way your knee hits. So you've got to look at your shoes. Now, all of us wear our shoes differently.
Right.
The majority of us will wear the shoe on the outside part of the heel. And that's because we strike with the foot just a little bit outer rolled, just kind of like that.
Right.
And so once you see that that's worn, you've already changed the way you walk. So you need to either fix those heels or get another pair of shoes.
I told you you're allowed buy shoes.
Now, the one thing I
You can
don't
get every
understand,
color.
the one thing I don't understand, and I've had my daughter try to explain this. What is it about black sandals? I mean, how many black sandals do you need?
Oh, a bunch.
No, just need one pair.
No.
That covers everything. No, you've got to have this one matches the jeans.
Yes.
And this one matches this
There's
skirt.
different
and-
styles.
Well, then you never wear your shoes down because you're always wearing a different pair.
So that's why I said it's a good idea to go
So you just
shopping.
give us permission.
But it can't be cheap.
Right.
So what I mean by that is European shoes are amazing because they last longer. They're more expensive, but they last longer and they have better support.
Right, because
They walk all the time.
Yeah.
So even if you've got an expensive shoe, I'm sorry, some of those designer shoes are horrible. They're horrible and they're expensive. But what I mean by a good shoe, you got to look at the way your arch sits in it, right?
Yep.
It's got to be good quality.
When you first put them on, that arch has to match the arch of your foot.
Right.
If it doesn't, if it's too far back or too far forward, you need to change the size up or change the size down, or even go to a different model because each of us has a different foot and may not match every shoe. Even within tennis shoes, each brand will have a different way that it's made.
Right.
The instep may be higher, the instep may be lower. The counter, which is the back part, may be too high and be hitting your Achilles tendon. So you need to really put them on, try them on the hard surface, on the tile. Don't walk on the carpeted area, and see how they fit in those first 10, 15 seconds.
Oh, no, that's a good piece of information.
Because after 15 seconds, your foot kind of gets used to it, and you don't feel it anymore.
Right. Right. And the other thing could be that if you've got one leg that's shorter than the other, it may be that hip is actually a little bit higher on the other. Wait, on that one. And you've actually got to get an insert on the longer foot to offset the hip. There's lots of things. They need to come see you.
Yeah, we can try to rebalance things.
Yeah, rebalance it. Well, this has been a great hour. I learned a lot about workman's comp, things that I really did not know before. So if anybody is listening, maybe they have somebody they know or they have been injured on the job, they certainly can call you. They're going to call 210-804-5400. You can go to TSAOG.com. And certainly San Antonio Orthopedic Group handles all types of issues with your joints, everything from neck, back, sports medicine, joint replacement, hand, wrist, and elbow, and all those good parts. It's been a joy having you on the show.
Thank you. It's been a pleasure.
Come back and see us, okay?
I will.
All right, guys, have a great weekend. Be safe, be happy, and stay healthy, and get off those ladders hanging those lights.